Good evening. I'm here to do a presentation on chest pain, anxiety and depression, and type D personality in cardiology patients. Oh no, my chest hurts. I'm scared. My head hurts. I have ringing in my ears, and I have 40 pounds of fluid retention. These are just some of the complaints with patients that have MIs, which are heart attacks, and surgery, and patients with congestive heart failure. My name is Christy Hearn, and I'm a medical assistant in cardiology. I work at University of Mississippi Medical Center, and this evening I want to discuss depression and anxiety in cardiac patients. The article I chose was published in May of 2011 by a few different authors, but one that stands out in particular is P.J. Tully. He works in cardiac and thoracic surgery unit in the Department of Medicine at Flinders Medical Center in Australia. Depression and anxiety are two main symptoms of cardiac patients. This article will represent me today best because I want to become an RN and work in the pediatric cardiology department. This evening I'll discuss depression and anxiety and type D personality traits in cardiac patients. First, let's talk about depression and anxiety. It's very common. There are screening tests for advanced treatment, and depression and anxiety are 3 times more common in patients after they've had a heart attack than in, say, like you and the general population. Second, characteristic symptoms of depression and anxiety is what we'll discuss. Constantly thinking about death or suicide is obviously a sign of depression. And excess weight gain or weight loss are the last that I'll mention of the characteristic symptoms of depression and anxiety. Lastly, type D personality. D just simply means distressed. Patients with type D personality traits often experience negative emotions, which cause emotional distress, which in return causes adverse cardiac outcome. Type D personality traits are proven to be more stable than those with clinical depression. In conclusion, 3 main symptoms leading to cardiac patients are anxiety, depression, and type D personality. Although I had help choosing my article, I feel it couldn't have suited me better because I love learning about heart disease. And I also truly believe it's important for people to understand the importance of treating depression and anxiety, because had people known sooner, they might not have had to say, oh no, my chest hurts, or I'm scared, or I have ringing in my ears. And this often happens with patients that are suffering from coronary heart disease. Thanks.
That's a wrap.
We'll get money for it this summer.